now recognize Mr. Bean.
Thank you very much, Mr. Chairman. Good afternoon to you, and good afternoon, Ways and Means Committee, and to our panelists. Welcome. We're glad to have you here. I, like Dr. Murphy from North Carolina, am a big fan of managed care. I was a state legislator for many years in the free state of Florida. We partnered with managed care to get our spending under control, and I think Florida has one of the largest state surpluses in the nation, is because we finally worked to make that happen. But I'm going to be honest with you guys. I am as confused as can be. I was hoping to learn what is the deal with managed care, because we've heard that the quality is high, but yet costs are, we don't know. Is it better than fee for service cost wise or not? What if there was a bill? What if there was a bill that required CMS, hear me out, CMS to release the full data of managed care versus fee for service, so we could see once and for all where the savings are and what's happening. I got good news, Ways and Means. I have filed that bill. I call it the apples to apples bill. Let's let CMS release the full data so we can make a full decision of where we need to go. I think healthcare is kicking our financial fanny as a country, and until we get those costs under control, then we're going to struggle with debt. So, first question, here we go, Mrs. Maroney. Some say we're saving money, some say we're not saving money on managed care. We know there's benefits. So can you tell me, is Medicaid Advantage delivering a cost-efficient solution for seniors and taxpayers?
Absolutely. When you look at the average consumer or beneficiary that enrolls into an MA plan, they're older than 71 years old. The average premium is about $17 for those individuals. However, for our program, most of those individuals have a zero premium plan. They have full comprehension when it comes to the Part C and the Part D.
How do you know?
benefit.
Do we have full data? You feel really comfortable if I were to ask you on a scale from 1 to 10, how confident are you on that answer? What would it be?
Probably about 9.5.
Okay, so you say there's room for improvement of that answer. So let's go to Dr. Miller, because you've talked about this in your testimony that we're not comparing. In fact, you've said it's apples to oranges, some of the data that we're getting from CMS. Wouldn't this be a good bill? And if you were in Congress, would you vote for the Bean bill, apples to apples?
I mean, I'd have to read the details, but I agree with the principles. I think right now we're doing apples to kumquat trees. So I'd take it a step further. The problem is that we're only looking at the beneficiaries who switch from fee-for-service to Medicare Advantage. We're not looking at beneficiaries who switch from Medicare Advantage to fee-for-service, and we're certainly not looking at the choice that millions of Americans make when they enroll in Medicare and comparing those bennies who are in fee-for-service and Medicare Advantage. So that 22% number, I actually think that it's not accurate because it only represents a small share of the Medicare population, and there was no control group.
10-4, no, thank you so much. Dr. Basil, welcome to the party. Jump in. What say you to having, I know docs like to have more information than less information, so what say you?
So as far as in my comments, one of the things we asked for was greater transparency. And so transparency is absolutely something that we support. Now, you asked about, how do you compare the quality before? And I can say that, within our own shop, in many ways, some of our Medicare Advantage patients actually have higher level of qualities. The percentage of our Medicare Advantage patients that get annual wellness visits is actually much higher in our MA plans than it is in our traditional Medicare plans, and many other quality metrics are that way. But we don't have that full realm of quality outcome to be able to compare apples to apples, I would agree.
10-4, in the state of Florida, what we do is we capitate the plans. We pay them, we already knew what fee for service was. We came in much under that and allowed managed care to go forward. Is there fraud and savings to be found? I'm working with this DOGE, the DOGE conference, so to speak, to work on savings. Is this a good place to look, Dr. Miller?
I'd say there are a couple bad actors that definitely probably deserve a visit with the Department of Justice, but on the whole, the program, I would say, from a fraud, waste, and abuse perspective, is not the major target.
10-4, 60 out of the 550 MA plans were audited last year. President Trump says we need to audit all of them. With that, I yield back. Thank you, Mr. Chairman.